Hello. A variety of spacer devices are available to help people use a metered dose inhaler. This video will show you how to give your baby or child their inhaled medicine with a paediatric volumatic spacer and a mask. A spacer is an attachment which makes it easier to use a metered dose inhaler, especially if someone finds it difficult to coordinate pressing the inhaler and breathing at the same time. It also helps to get more medicine into the lungs. If the inhaler and spacer are used correctly, your child should have better control of their breathing problem. But if used incorrectly, your child may have poor control of their condition, with the risk of side effects, such as a sore throat or mouth infection. The paediatric volumatic spacer comes with a mask, which must be used until your child is old enough to use the spacer mouthpiece properly. To assemble the spacer, push the mask firmly onto the spacer mouthpiece. Then firmly fit the two halves together. If possible, your child should sit upright or stand up when using the metered dose inhaler and spacer. For babies, you should either cuddle them on your knee or cradle them in your arms. Remove the cap from the inhaler. Hold the inhaler upright and shake it firmly 4 or 5 times. Insert it into the spacer. When you're ready, apply the mask gently over your child's nose and mouth. Make sure that you have a good seal so that none of the medicine can escape. Press the top of the inhaler down to give a dose of the medicine. Hold the mask firmly in place whilst your child takes 5 normal breaths. If it's difficult to count the breaths, then make sure you hold the mask in place for at least 10 seconds. Although up to 30 seconds is better, if possible. Encourage your child to breathe in and out through their mouth if they're old enough to understand this. You should be able to hear the mouthpiece valve click or rattle as they breathe in and out. If you cannot hear this, tip the paediatric volumatic upwards and try again. Tipping it allows the valve to stay open. Remember that once you press the top of the inhaler, your child needs to breathe in straight away. Otherwise, the medicine will fall to the bottom of the spacer instead of going into their lungs. So don't press the inhaler until you have the mask in place and are happy that there's a good seal. After 5 breaths, or at least 10 seconds, remove the mask from their face. If the doctor has told you to give 2 puffs, wait for 30 to 60 seconds and then repeat the whole process. Remember to shake the inhaler between doses. Once finished, replace the cap on the inhaler to keep out dust. If the metered dose inhaler contains a steroid, usually known as a preventer, make sure you brush your child's teeth or get them to gargle with water after every use to prevent mouth infections. It's important that you look after the spacer, and here are some tips. Wash the spacer before its first use and then twice a week. Gently pull the 2 halves of the spacer apart and remove the mask. Do not take the valve apart. Wash the parts in warm water with washing up liquid. Do not rinse the spacer and do not rub it dry. Let the parts air dry naturally at room temperature. Washing and drying the spacer this way helps to stop static building up, which can stop the spacer working as well as it should. Your child's spacer should be replaced every 6 to 12 months, but some may need to be replaced sooner. If you're unsure about how to use your child's metered dose inhaler and spacer, speak to their GP, practice nurse or pharmacist for assistance.